Okay, here we go. Advanced self-massage for the foot and ankle, hand and wrist. So I hope you're ready. We're gonna explore a little bit of what the anatomy looks like in the forearm and in the base of the foot, because that's what we're gonna be exploring, and in the calf and the shin. So just taking a look at all the plantar muscles, ton of muscles at the base of the foot. It's amazing how much tension actually builds up and how much force it can handle. And when you start really sinking into the hands, into the feet with more pressure, how much tension we have in our hands and feet, it's just incredible. So we're gonna get deep into that anatomy and exploring what areas to target and how to get in there without killing yourself to get maximum force applied to the muscle that you can handle, that you can relax to, and that doesn't kill you in the process. So some of the calf muscles, the gastroc, the soleus, the peroneals, tibialis anterior, peroneus longus. So those are some of the muscles of the lateral leg. Those are all areas we're going to be targeting. And if we get into reflexology, so the foot and the hand are maps of the body. So this is Asian medicine. And if you don't subscribe to it, that's fine, but just pay attention to if we're targeting any area of the foot or hand and you find a spot that's really relevant, really tight and knotted, just glance at the map and get a sense of what that refers to, what part of your body it refers to. So that can either be information that you can use, or you can actually follow to that part of the body and target that part of the body with direct pressure. That's another method you can use to, use information that other countries, other cultures have learned how to take care of themselves and find better levels of health. And that's really what we're after with this training, is how can we improve your health, improve the health of your foot, improve the health of your entire body. And if we can use the system of reflexology to help you understand that and target it more specifically, let's use it. So the same map goes on for the hands. You can find different areas of related to your hands. So if we explore something and you find an area, just tune in, check out the map, see what it looks like for you, and if it makes sense, follow that out, or maybe it's related to an organ, just so you can have more information that you can talk to your acupuncturist about, talk to your homeopathic therapist about. Okay. So the first one, starting with foot massage, we're going to get into a push and pull technique. So it's some of these techniques I learned a long time ago, but they're amazing at easy to teach, easy to learn, easy to do. So if you remember us doing the push-pull with the arms straight to open up the shoulders, we're using that same movement, and what we're doing is just getting all those bones of the foot to have to shift. Okay, so you can grab the entire side of your foot and press that external part, maybe the part that we're working on that's tight for the this ankle sprain. We can press it down. As we press it this way, I'm pulling on the toe, on the big toe, in the opposite direction. So I'm pushing here, pulling here, and then doing the opposite. I'm pushing with the toe and pulling with the lateral side. So it's back and forth, and notice whatever you notice. And if you find an area that feels like it's really tight, you can hold that position. So the techniques that I'm going to show you are not the traditional Swedish style. They're holding specific points, they're anchoring in points, and they're collapsing tissue, but they're not rubbing. So it's taken me a long time to get to a place where the most effective treatment is when I'm letting go, or you're letting go of your tension. And sometimes for me it takes being still and giving the body a chance to do that versus kind of forcing it to do that. So we're just targeting the areas that are tense, giving it a little bit of stimulation, a little bit of energy, focusing our breath on telling that arch of my foot, or what's going on with the top of my foot, to open up and let go, and then just being patient, visualizing our breath going in, our mind telling our body to open up. How much deeper can I go with that? And the body has a way of adapting to whatever you ask of it. So I'm getting the toes. You can get the toes kind of opened up and spread out. So I'm using direct mechanic on each of the toes, pushing one toe forward, one toe back. Okay, so separating each of those metacarpals or metatarsals, forward and backwards, getting some movement in between each of the toes, forward and back. You can do flexion and extension with this, so you can curl the toes forward, just hold a nice gentle contraction forward, and then you can pull back. All right, do the same thing pulling back. So it's a lot of this push-pull, different directions, forward, backwards, lateral, twisting. That's another one that was on the other page, but just twisting, same thing with the push-pull. You're twisting the base of the foot, and you're using your thumbs to really get in there. It's maybe easier like this. So you're using your thumbs to, as I twist, you're using your thumbs to kind of hit one area and then push back and forth. So your thumbs can really be, as I grab it, I can start to use my fingers and thumbs to target more specific areas within the base of the foot. With the anchor call to motion, we're finding one spot. So this is kind of the warming up, the ringing, the push-pull. We're finding one spot that feels like it's a good area to apply some pressure to, okay? So the way I like to put pressure, I use my hand and I just go in like a knife. You can also use your thumb, so you can hook your thumb in like this, using both thumbs. So as I was saying, you can bring the tissue, you wrap it around the pressure. So whatever technique, whatever your hands feel like they feel comfortable applying some pressure, you're just going to sink in, find one spot on the base of your foot. Okay, that's all we're looking for, one spot that feels tender to the touch. Okay, so kind of explore what it feels like in that arch, base of the foot. You're kind of using your sense of intensity and pain to find a spot. So usually along the arch, this is considered your spine. So it's a good idea to spend a lot of time, especially if you're dealing with plantar fasciitis. That muscle that attaches onto the first metatarsal and the heel can be really have a lot of tension along that arch. So I'm going to find one spot and I'm going to target and sink in on that spot, and then the anchor call to motion is engaging that muscle under that direct pressure. So I'm pushing in and I'm moving the toes to activate that muscle under direct pressure. So instead of me, moving my hand and doing a massage like that, I just sink in, find a comfortable position, and then move the muscle under that pressure. And that is giving it a pretty good intense treatment without a lot of force. Okay, and you can really collapse that tissue around the pressure and then extend it. And that leads into our next technique with the fulcrum wrap. So it's essentially wrapping the tissue like a fulcrum around your contact. So with that anchor call to motion, I was flexing, extending. If I just hold pressure and continue to bend, you're folding it like a fulcrum around the pressure, and that can be extremely therapeutic if you find a good spot and you just hold that compression. So you're just folding the tissue around the pressure, you're shortening that tissue, and you're holding direct force. And what's going to happen is the tissue is going to begin to open up, and you're going to be able to sink a little deeper. So just explore what that looks like. Targeting different areas. You can target between the toes. You know, you can squeeze the toes, work on the individual toes. Those can be pretty tender, so you can squeeze each of the toes, hold a bit of pressure. You can squeeze up the side. This is I think it's a Brazilian technique that I learned, but you can squeeze the sides of the toes and then squeeze the middle of the toe. You can get underneath the arch of it, so you can bend each toe around where it bends, right in the belly there. You can apply that fulcrum to the base of the toe, and really gently, that's going to get some good, and I'm not working hard, I'm just putting a little bit of pressure, like a nickel's worth, a dime's worth of pressure, and I'm bending the toe towards that force, and that creates a more intense stroke. Plus I'm shortening the tissue, so it allows me to go a little deeper, and I can just keep bending forward that toe and holding pressure, and it's just going to start releasing. So along the big toe, that's your neck, so tensioning your neck. So if you go to the big toe, put a little bit of pressure at the base of the big toe and collapse it and hold. Just notice if anything's going on within your neck. And this is something while you're watching your movie, while you have a little bit of downtime, if you have any downtime, you can be playing around with how to give yourself a good foot massage. Okay, so that's fulcrum wrap. Then we have the compression with activation. So if we're getting into the shin, again, I don't like to do a lot of massage, so this is just compression. So I'm just kind of squeezing the muscles with my hands, just like squeezing a towel. And then the activation, I move the foot and ankle under that pressure. And so really you're kind of exploring now, because I don't want you to tire your hands out, but you're finding what's going on within my leg that has tension. So I can feel some tension in my calf. Okay, so a lot of the times I'll take my calf, my gastroc and my soleus, and I'll bring my hands together. Okay, so I'll actually shift the tissue. I'll bring the tissue of the gastroc and the tissue of the soleus together and hold that tension, and that's it. Just give it a bit of a directional compression together and hold. And you're shortening that tissue, giving it a little bit of a challenge, and it can melt pretty quickly just doing that. So with the shin, you can interlock your fingers, squeeze the shin, and then do that activation under that compression. And this is again creating a massage stroke without me having to do a whole lot of work. So I'm just squeezing my hands, my palms together, applying a little bit of pressure along the tibia, on the inside and the outside of the tibia, and then doing small little activation movements. And that is a good treatment for the lateral shin. All right, and then if we get into the forearm, this is an area which I could work for hours. So you've got the muscles that attach at the wrist up to the elbow. So your hands, this is one of the things that working on myself, and I use my hands, so it makes sense that they're tight, but I'm not the only one who has tight hands. So using your fingers, you can just squeeze areas just using your fingers. Just kind of find an area within the hand, target one area. So in between the index finger and your thumb is a good spot to target with the thumb and the finger. So you can just squeeze that. That has a lot with migraine headaches that can be pretty helpful. It's just an amazing trigger point. So I'm not putting a whole lot of force, I'm not squeezing hard, I'm just applying a little bit of force right into the little belly of muscle in between the thumb and index. So you can apply some pressure. If you squeeze harder, you'll notice what's going on deeper. And just holding pressure. You can do your thumb or your fingers. I find my fingers are really helpful. You just kind of apply a little bit of force like that fulcrum wrap, and then collapse your hand around that, and start exploring what's going on in your hands, because this is incredible work, especially if you're dealing with like carpal tunnel. But even if you're not, maybe you're dealing with numbness and tingling in your hands. A lot of the nerves ending in your hands and in your feet. So you're helping open up those nerve pathways by releasing tension in the foot and hand. And you really can't get enough work done, because as you start exploring it, you're going to find in the belly of the thumb how much tension we are carrying. So be gentle, explore, use whatever tools. I sometimes use my elbow if my fingers are tired, so I use my elbow, and I'll just get my elbow into the hand and just rest it there, find a good spot, and then hang out. So I can do this for a while, just bring in some blood flow and direct energy into the whatever area I'm targeting, and it doesn't require a lot out of me. So it's an exploration. Find what feels good, apply whatever force is appropriate for you, hold it as long as you want. You can't over recover, and we're at a deficit of recovery, I would say. So give whatever time you can towards this effort, and you're going to be opening up your foot and ankle. The communication that you're going to have between your joints is going to improve, because like I said, the nerve endings are ending in our hands and feet. So if you start opening up those channels, the communication up the chain is going to improve. And working then into the forearms, you're going to feel all kinds of bundled muscles, all kind of little wiry cord-like things. So those are the areas that I like to just apply a little bit of pressure with my thumb and shorten it. So in that little image there, I'm taking the thumb, so the muscle is here, and I'm pushing the muscle down towards where it's inflamed, where it hurts. So I'm shortening the muscle, or sometimes you might take the muscle away from that area and see if that feels good. So tissue has a preference. So does it feel better for me right now to take the tissue, find that you can see it rolling underneath my fingers? It's a cord. So does it feel better to sink in and apply a little bit of traction away from the elbow? Or does it feel better? So that feels pretty good. And then how much can I do? So sometimes you have to use your other elbow just to get the depth you want. Or does it feel better to sink the tissue towards the elbow? And so it's applying direct force, 45-degree angle, going at an angle. So not 90 degrees, we're going at an angle, 45. And find the areas so it's much easier with the elbow on the outside of your arm. So you can use that elbow to slowly, so yeah, this is heavenly pretty much. If you find a little area, apply a bit of force, not too much, track it, so I'm sinking and I'm shifting. Okay, I'm not forcing down, I'm sinking and shifting. So it's kind of like I'm drawing that muscle away from the elbow, and it's referring down into my hand. And so this hopefully is something that makes sense to you on how how to apply some direct force. If you look at the Star Wrap, that's a wearable recovery system, so it would do all of this for you. But that's my advanced next level training. So right now, if we get into that, pretty much completes the self massage for the hands. So now we're going to get into the Star Stack method and how to use the tool so your hands don't have to do the work, and you can just lay on the tool, use the Star Stack in order to create a lot more pressure, a lot more intensity without working harder, with working easier, with working less actually. So on to the Star Stack method for the foot and ankle, wrist and hand.